Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I started doing this as I was creating what I needed to pass boards, what I needed to go from that 5-point deficit for my initial unsuccessful attempt. So, the strategies and things that I provide to you, the approaches and breakdown that I provide for our daily practice questions in my review questions, I have utilized on myself and thousands of other nurse practitioner reviewers and nursing students. I put a lot into this because your success is my success. Like anybody that has worked with me knows that I say that I'm in this with you, and I truly mean that. So I hope that y'all are finding these videos helpful, but I wanted to share a little bit about me as well. Now, y'all know I always like to go over the disclaimer also that we know that there's no absolutes in medicine. We treat on a patient by patient basis. So, any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. And I say that because I know things that are there's so many variables in healthcare, and we do things in a way in practice based on the patient that is in front of us. But always remember, y'all, for testing purposes, things are going to be the perfect textbook scenario. And remember the way that the tests are put out. And so, guidelines that are on the exam, they're going to vary from what we may currently be utilizing or what has currently been updated in practice. So, I always teach from that perspective, okay? But anyway, with that being said, let's get into question number one for today. Question number one states a 28-year-old woman presents to your office with complaints of dysuria, increased frequency and urgency for the past 2 days. She denies fever or flank pain. On examination, her vital signs are stable, and a urine dipstick reveals positive leukocytes and nitrites. What is the most likely diagnosis, and what is the next step in management? Is it A, pyelonephritis, and initiate a 7 to 10-day course of antibiotics and refer for further evaluation? B, a UTI and treat with a 3-day course of Bactrim? C, a UTI and treat with a 3-day course of nitrofurantoin? Or D, a UTI and no antibiotics are needed, suggest increased fluid intake? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the most likely diagnosis and what is the next step in management, right? So, we're trying to figure out the diagnosis and the treatment, right? So, I always say, first, for diagnosis purposes, you got to run it back and look at those assessment findings. And, I always tell you with treatment, you need to look and see if they provided you with the diagnosis. And if they have not, you need to run it back and look at the assessment findings. We know they have not provided the diagnosis because it's asking for the diagnosis. So we got to start from the top and work our way down, right? So we're going to look at those assessment findings and gauge what's going on. So we have a 28-year-old female, right? Comes to the office. She's complaining of dysuria, urinary frequency and urgency for the past 2 days. She does not have a fever or flank pain. So what does that tell us already? That alone should be gearing your mind to think about potentially a UTI. You're going to start to think she doesn't have flank pain. So flank pain is classic presentation for pyelonephritis. So we can start to kind of just think and rule that out. But now let's look and see what the exam findings have shown us. The UA does show positive leukocytes and nitrites, so that confirms a UTI. So we know we have a UTI. So now, how do we treat our UTI? So I always tell y'all to think about complicated and uncomplicated UTIs because that lets you know the duration of treatment, right? Because if it's complicated, you need to treat for 7 to 10 days, and then if it's uncomplicated, you can treat from 3 to 5 days. So this is a 28-year-old woman. Females are considered uncomplicated. She doesn't have any strange symptoms. She's not pregnant. So this is uncomplicated, right? So let's see. We want to go with our first line therapy. C is your best answer, right? Because it's a UTI. That's a diagnostic answer, right? A 3-day course because she's an uncomplicated UTI. And your nitrofuran 20 is that first line therapy. You could rule out A because, again, it's not pyelonephritis. She doesn't have any flank pain. She doesn't have a fever. So we can rule that out. B, if you have the choice of nitrofuran 20 versus Bactrim, nitrofuran 20 would be that first line therapy based off of guidelines, y'all. And then D, we know we're not going to just not do anything, right? All right, question number 2. A 72-year-old male presents with a 3-day history of increased frequency of urination, nocturia, and a sensation of an incomplete bladder emptying. He denies fever or pain. On exam, he is afebrile, and a urine culture grows E. coli. His past medical history includes BPH and diabetes. What is the most appropriate course of action for this patient? Is it A, to treat with a 7 to 10 day course of antibiotics tailored to the organism? B, advise watchful waiting. No antibiotics are needed at this time. It's likely asymptomatic bacteria. C, prescribe a 3-day course of Bactrim for a simple UTI. Or D, initiate a broad spectrum antibiotic immediately and refer to urology for evaluation. Take a moment and tell me what you got in the comments. All right, so here the stem of the question states, what is the most appropriate course of action for this patient? All right, so what do we have going on? We have a 72-year-old male. He presents with a 3-day history of increased frequency of urination, nocturia, sensation that his bladder is not completely emptying, no fever or pain. On exam, he is afebrile, but the culture has come back for E. coli. So what do we want to do for this, right? So we know we're going to need to treat this E. coli that has grown on the culture, right? So would you treat with a 7 to 10 day course of antibiotics tailored to the organism? Yes, that's your best answer. One reason, you know it's going to be 7 to 10 days because this is a elderly male. The elderly and males fall into that complicated UTI category, right? Also, you want to make sure that we have a culture, so you want to tailor the antibiotics to the organism that has found to be that has grown, I should just say. So A is your best answer. You know, B, we're not going to do watchful waiting. Absolutely not. C, the 3-day course alone should tell you no because this is the complicated UTI, but also it says for a simple UTI. This is not simple. So A is your best answer, okay? All right, and lastly, question number 3. A 30-year-old pregnant woman at 20 weeks gestation presents to your office with mild dysuria and increased frequency of urination for the past 48 hours. She has no fever or flank pain. A urine dipstick is positive for leukocytes but negative for nitrites. A urine culture confirms the presence of E. coli. What is the best approach to treating this patient? Is it A, prescribe a 3-day course of nitrofurantoin? B, initiate a 7-day course of amoxicillin? C, treat with a 3-day course of Bactrim? Or D, recommend increased fluid intake and monitor as antibiotics are not recommended during pregnancy? Take a moment and tell me what you got. All right, so stem of the question, what is the best approach to treating this patient? So what are we treating? Here it's telling us we have a 30-year-old pregnant woman at 20 weeks gestation in the office. She has mild dysuria, increased frequency. So we're thinking UTI still, right? No flank pain. So, okay, UTI. The leukocytes are positive. The culture shows E. coli. So definitely a UTI. We need to treat. So how do we treat this type of patient? Remember, is it uncomplicated or complicated? So you can think about the duration. She's pregnant, so it's considered a complicated UTI, right? So we want to do a 7-day course. So you can go ahead and rule out A and C. But also remember with pregnant patients, we typically go amoxicillin for the management as they're able to receive penicillin while pregnant, okay? You know, we don't give sulfa meds to the pregnant population. So your best answer is B, initiate a 7-day course of amoxicillin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. I appreciate all of you guys who have shared, like, and your feedback. It helps to spread the channel to other reviewers who may need, or students who may need assistance. And I'm just trying to put things out there for you guys to help you on this journey, but it also helps the channel, and I greatly appreciate you. And thank you for all of you guys who are adding your feedback, because I don't know how well y'all receive it if you don't respond and tell me. So y'all have no idea how much y'all make my day when you comment and let me know. And lastly, as always, if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio. You can give us a call at 803-400-6864, or shoot a text message to this number, or you can shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any one-on-one sessions or any of the customized or personalized packages, I always say either call, text, or email. I have removed it from the website because I prefer to speak with you guys so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.